Hi everyone, this is Dr. Ina Irabon, and in behalf of the Philippine Society for Reproductive Medicine, I would like to warmly welcome everyone, all of you out there, our beloved patients, our healthcare partners, and our patients' loved ones who have tuned in today. We really appreciate your time and effort to spend the next few hours with us in your quest to better understand a very common gynecologic condition known as polycystic ovary syndrome, or what we simply call as PCOS. Sadly, even if we always say that PCOS is quite common, we notice that most of our patients are quite misinformed about PCOS. Kaya nga we are very glad that we have been receiving good feedback from our patients, signifying their intention to listen in today. And we hope that after this session, you will understand PCOS better. Kasi pag mas naunawaan po natin ito, then mas maintindihan po natin kung paano natin mapapabuti ang ating mga sarili at maiwasan sana ang mga medical consequences or complications that may happen when PCOS is not managed well. Like we always say, no, good information is critical to achieving the best health outcomes. And that's why this lay forum is meant to empower all of you, our dear patients, through education. So this lay forum will come in two parts. The first part, of course, is today, and we will focus more on hyperandrogenism. Tapos, in the next few weeks, fertility issue naman ang focus natin. Kasi kulang na kulang ang oras natin tonight if we discuss all aspects of PCOS in one sitting. So this is the outline of my lecture for tonight. So we shall discuss ano ba talaga ang PCOS? What is the definition of PCOS? How do we diagnose PCOS? What are the signs and symptoms? What are the many phases of PCOS? Iisa lang po ba ang ang clinical picture niyan, o marami po bang types or phenotypes ng PCOS? Let's tackle a little bit about pathophysiology. I know it's complex, but I'll keep it simple for you. The consequences of an improperly managed PCOS, and the last part, we'll talk about the treatment. So what is PCOS? PCOS is the most common endocrine disorder among reproductive age women. Ano po ba ang endocrine? Anong ibig sabihin yan? Endocrine meaning may kinalaman sa hormones po natin. So the classic features include signs of elevated androgens. Doktora, ano ba ang androgens? Androgens po, ito po yung mga hormones na karaniwan pong matataas ang level na nakikita sa mga lalaki, hindi po dapat sa babae. No? And signs of this will be yung acne o yung mga pimples po sa mukha natin, sa likod, or dito sa chest area. And hirsutism. Ang hirsutism po, ito po yung medical term na ginagamit po namin mga doktor pagka ang isang pasyente ay tinutubuan po ng maraming buhok sa mga parte ng katawan na hindi naman po dapat tubuan ng maraming buhok. No? So, also kasama po sa classic features yung irregular periods or menses. And ang incidence po ng PCOS usually nasa 5 to 10% of the population. Lalong-lalo na dito po sa area natin sa Southeast Asia, which of course includes the Philippines, mga 5 to 10% po ang incidence. However, using a broader, now more conventional definition, it can be present in as many as 15 to 20% of reproductive age women. And the incidence is higher po sa mga counterparts natin na mga Caucasians. Now, how is PCOS diagnosed? To get the diagnosis of PCOS, you need two of the following three criteria. And this criteria we call as the Rotterdam criteria. So ano po itong tatlong criteria? Number 1, irregular menses or periods. Number 2, hyperandrogenic symptoms. Pag sinabi po nating hyperandrogenic symptoms, ito po yung acne, hirsutism. Sabi ko po sa inyo, yung hirsutism is the increased growth of hair in body parts that we don't expect to have increased growth of hair. Tulad ng sa face, sa stomach area, sa back area, or sa chest area. No? Later on, I will show you a diagram of how we evaluate hirsutism. Or pwede din po yung mga doktor ninyo or gynecologist, they could request for blood test, no? To check for high levels of androgen hormones. And also, on transvaginal ultrasound, there is a finding of at least 20 follicles in at least one ovary. In other words, ladies and gentlemen, PCOS is not diagnosed based on ultrasound findings alone. Di porket binasahan po kayo ng polycystic ovaries on ultrasound, automatic may PCOS na po kayo. Kasi according to this Rotterdam criteria, you need at least 2 of the following 3 criteria, di ba po? So if you have an ultrasound finding of polycystic ovaries, tapos wala naman po kayo no other 2 criteria, then chances are you may not have PCOS or baka iba po, meron po kayong ibang kondisyon, no? Pero mas maigi na po na magpakonsulta po muna kayo sa gynecologist niyo or sa reproductive endocrinologist for a more comprehensive evaluation. Please refrain from making the mistake of self-diagnosing yourselves or gagayahin niyo lang po yung treatment ng kapitbahay niyo, ng kaibigan niyo just because you think you have PCOS. Alright? So many women with irregular menses and hyperandrogenic symptoms can be diagnosed based upon history and physical exam alone. However, the diagnosis of PCOS is only confirmed when other conditions that mimic PCOS are excluded. Ano pong ibig sabihin nito? So, marami po tayong mga other medical conditions na may mga sintomas na kahalin tulad po ng PCOS. And that's why it's very important po na wag po kayo magsi-self-diagnose ng PCOS, patingin muna po kayo sa gynecologist or reproductive endocrinologist because these doctors will help you confirm if you really have PCOS. Kasi baka ina-assume nyo you have PCOS, but then again, hindi po pala, no? It's another medical condition. Ano po itong mga medical condition that mimic PCOS? Pwede pong may thyroid disease kayo, non-classic congenital adrenal hyperplasia, mataas po ang levels ng prolactin or hyperprolactinemia, or worse, no, baka naman the hyperandrogenism is because of a tumor, an androgen-secreting tumor in the ovaries or adrenals. So what are the symptoms of PCOS? PCOS is very complex because it has reproductive, metabolic, and psychologic features as you can see in this list, no? So we've already mentioned irregular periods or menses, excess hair growth, no, on body parts that you don't expect hair growth, no, like the face, the chest area, the back. Later on, I will show you that diagram, no? Yung paglalagas ng buhok or yung loss of hair on the top of the scalp, acne or pimples that may be very severe, weight gain, difficulties in getting pregnant or yung tinatawag nating infertility, emotional challenges, increased risk of diabetes with earlier onset of diabetes, sexual health challenges, low self-esteem, poor body image, and of course, poor quality of life. So ito po yung sinasabi ko sa inyo kanina na diagram that we use for evaluating hirsutism. And this is what we call the modified Ferryman-Galloway scoring. Okay, so notice here that we are looking into 9 body parts with excessive growth of hair. So una muna yung upper lip area, in the chin. So yung parang may bigote, no? Tapos yung chest area, look at the hair growth there in the upper abdomen, lower abdomen, in the upper arm, the thighs, upper back, and lower back. So lahat yan, tinitignan namin, inuusisa po namin yan, at kinocompute namin po yung total modified Ferryman-Galloway score. Kasi kung ang score nyo naman po nasa 6 and below, normal naman po yon. So wag po kayo mag-aalala. Pero kung halimbawa, mild or severe lalo, no, then we will really have to evaluate you on severe hyperandrogenism. Okay, so women with severe hyperandrogenism, no, they require a more extensive evaluation of the most serious causes of androgen excess, tulad po ng mga androgen-secreting tumors from the ovary or the adrenals or ovarian hypertrichosis. So as I've mentioned earlier, PCOS has different phenotypes, no? Hindi lang po iisa ang mukha ng PCOS, marami pong klase yan. Okay, so we have at least 4 phenotypes of PCOS. So first, we have the type A. Ito po yung mga pasyente natin na merong lahat ng 3 criteria. So hyperandrogenism, irregular po yung menses nila, and on ultrasound, they have polycystic ovaries. So that's the type A phenotype. The type B phenotype will be those patients na merong hyperandrogenism and irregular menses, pero nung in-ultrasound sila, wala naman po silang polycystic ovaries. Okay, so that's type B. Type C will be those patients na may hyperandrogenism and polycystic ovaries on ultrasound, pero regular naman po yung menses nila. Okay, and lastly, last phenotype natin, ito yung mga makikinis ang mukha na walang acne, walang hirsutism, and they're the type D. Sila po yung may irregular menses at polycystic ovaries on ultrasound. Pero, wala po silang hyperandrogenism. Okay, so they're called the non-hyperandrogenic PCOS phenotype. Now, this is a very nice patient info guide and actually an evidence-based information pamphlet that is made for patients with PCOS. And this is published by the Monash University. It's called the Ask PCOS pamphlet. No? You can download this from this website that I placed here. No? Sabi nila dito, when do you suspect PCOS? No? So meron sila ditong parang mini quiz. No? Let's see. No? So if you have a close female family member was diagnosed with PCOS, no? Do you have an irregular periods? Do you have acne that may be severe? Do you feel that you have more body hair than your family members, such as your face or the chest area? If you say yes to most of these questions, then it says here that you have to see your gynecologist or reproductive endocrinologist for a more comprehensive evaluation. So let's talk a little bit about pathophysiology lang. Alam ko this is a very complex, very complicated topic on PCOS, but I'll keep it simple as promised. No? So there are three major pathophysiologic pathways that have been described for PCOS. So ovulatory dysfunction, disordered gonadotropin release, and insulin resistance. So mahirap na pong i-explain ito no, sa inyo. No? Pero let me just say that genetics and environment both play major roles in the pathophysiology of PCOS. Okay, so this is a very nice diagram showing to you the pathophysiology of PCOS, and I would like for you to focus your attention on this, no? Insulin resistance. Yan po yung punot dulo, no, ng PCOS, yung pinanggalingan ng PCOS. At kung mapapansin niyo po, insulin resistance din po ang pathophysiology, or it shares a pathophysiology with type 2 diabetes mellitus. It's also the reason why diabetes mellitus is very common, or a family history of diabetes mellitus is very common among patients with PCOS. Now, insulin resistance, because of this pathophysiology, it is recommended for all PCOS patients that testing should be directed at ruling out diabetes and glucose intolerance. And how do we do that? No, as mapapansin niyo po, for those who in the audience who have PCOS at nagpatingin na po sa gynecologist or a reproductive endocrinologist, di ba po, yung doctor niyo po, she requested for 75 grams oral glucose tolerance test. Ito po yung test na pinainom po kayo ng matamis, tapos kinunan po kayo ng dugo ng 3 beses. No? Yun po yung tinatawag na OGTT. May mga ibang doktor po na imbis na OGTT, baka ang ni-request ay HbA1c or hemoglobin A1c. Okay? Now, meron din naman pong mga ibang doktor na ang ni-request po ay FBS or yung fasting blood glucose or fasting glucose levels. Pero we don't really recommend no, na FBS po ang i-request because it is a poor predictor of diabetes in PCOS. Now, let's talk about the consequences of polycystic ovary syndrome. So you can see here, no, meron po siyang spectrum ng consequences that runs from a young age to older age women. And you can see here, no, so the consequences are mainly reproductive and metabolic. Reproductive meaning maari po kayo magkaroon ng problem regarding fertility, no? Or kung mabuntis man, maaari pong magkaroon ng complications during pregnancy, no? Or pwede rin po magkaroon ng diabetes, cardiovascular disease, or increased cancer risk. Okay? But with proper treatment and monitoring, of course, maiiwasan natin po ito. So, pag-usapan po natin ito ng mga nabanggit po nating mga consequences ng PCOS. So, first is weight gain, obesity, and metabolic syndrome. Weight gain, as women age, is a major predictor of abnormal metabolic findings and the emergence of cardiovascular disease risk. Now, all of the symptoms of PCOS become worse with increasing body weight. That's why po, makulit po kami sa inyo, no? Kaming mga doktor, napakakulit po namin when we tell you na please lose weight, no? That's the first thing to do, lose weight, because all the symptoms of PCOS gets worse with the increase in the body weight. Okay? So lifestyle management has to be a priority for women with PCOS and must be maintained lifelong. Hindi pwedeng nag-lose lang po kayo ng weight for a short period and then babalik na naman po kayo sa dati nyong gawi, no? Lifestyle management should be the first line management in all patients with PCOS, whether obese yan or underweight or a patient who is lean. Number 2, diabetes. Okay? So, patients with PCOS, they have increased risk of developing type 2 diabetes, lalo na po yung mga pasyenteng obese, no? And this is, again, driven by, yung sinasabi ko po sa inyo kanina, insulin resistance, which in turn is worsened by overweight status or pagiging obese. No? Thus, it is extremely important. Paulit-ulit ko na po itong sinasabi. It is very, very important to screen for diabetes in the overweight population with PCOS. And this is best done, as I've already mentioned, through OGTT or 75 grams OGTT or yung iba po, HbA1c. Pwede rin po yun. Number 3, quality of life issues. Okay, these women are prone to have a poor quality of life, and this is most likely related to their burden of becoming overweight, having irregular cycles, and having infertility. No, you're suffering from infertility and having skin concerns, like for example, hirsutism, tsaka acne. And all these can possibly lead to depression and anxiety disorder. And usually kasi ito yung mga pasyente na talaga na-frustrate na sila with the various treatments, no? Number 4, cardiovascular concerns. So women with PCOS have characteristic lipid and lipoprotein abnormalities that tend to increase cardiovascular risk. And data have largely been obtained from women with more classic features of PCOS, particularly those with obesity. Okay, 5th, cancers, no? So both endometrial and ovarian cancer are found to be increased, no? In patients with PCOS, especially po yung mga pasyenteng obese or overweight at meron na pong nag-develop na po ng hypertension and diabetes. Now, the risk naman for all cancers increases with aging. However, in patients with PCOS, endometrial cancer can begin at a younger age because of long-term anovulation, obesity, unopposed estrogen stimulation of the endometrium, and possible diabetes and hypertension. Now, for the last part of this lecture, we talk about the treatment of polycystic ovary syndrome. So the treatment of women with PCOS should be directed at the specific complaint. Natatandaan niyo po, nabanggit ko po kanina na hindi lang po iisa ang mukha ng PCOS. No? Depende po sa kung ano po ang manifestations niya, marami pong phenotypes ng PCOS. And therefore, iba-iba po ang concerns ng taong may PCOS. Hindi po yan lahat dekahon. Hindi po lahat iisa ang complaint ng babaeng may PCOS. And therefore, treatment should be directed kung ano po yung chief complaint o chief concern ng patient with PCOS. And these concerns fall into 3 main categories. And what are these? Number 1, probably the patient comes to you or comes to the doctor because of androgen, signs and symptoms of androgen excess, no, or hyperandrogenism, no? Pwede kasi yung concern nila is because of yung acne na hindi na po nagre-respond sa treatment na binibigay ng dermatologist, di ba po? Or hirsutism. Pwede din po na yung pasyente, ang concern naman niya is yung irregular menses po niya. Or pwede rin po na ang pasyente, ang main concern is because of infertility or yung hirap po magbuntis. Okay? However, regardless of the complaint, lifestyle management, no? Paulit-ulit ko na po sinasabi, lifestyle management in the form of proper diet and exercise is an extremely important component of any treatment regimen for PCOS. Okay, so what if the patient has androgen excess? So aside, of course, from lifestyle management, what other treatments do we give these patients? So kung may mga patients po kami na may mga signs and symptoms of androgen excess, like for example, acne, what we usually recommend will be oral contraceptive pills or combined oral contraceptive pills. But, okay, so hinay-hinay lang po, hindi po kahit anong pills ang pwede nyong gamitin. Okay, wag basta-basta kahit anong pill ang kunin ninyo at i-take ninyo, no? So, we usually recommend COCs or combined oral contraceptives with an anti-androgenic progestin component, no? Tulad nung cyproterone acetate, or sometimes we also recommend the one that contains drospirenone. Or some of the gynecologists, or some of you may have been given spironolactone or finasteride. How about those patients na may irregular menses or infrequent menses? Okay, so the treatment for these patients should be directed at supplying the missing progesterone in anovulatory women. So in this symptom of irregular bleeding or infrequent menses can potentially lead to endometrial cancer if not treated, no? And women who are overweight and older are a higher risk group, no? And endometrial biopsy may be indicated in some. No? So we will request naman diagnostics for that before we do endometrial biopsy. And oral contraceptives or combined oral contraceptives may be indicated for treatment of symptoms of androgen excess. Tulad po nung nabanggit ko kanina, no, sa previous slide. So, pwede pong bigyan ng combined oral contraceptives tulad po ng unang nabanggit, or maari pong iba sa inyo, imbis na combined oral contraceptives ang na prescribe, maari po kayo na prescribean ng mga progestogens or progestins tulad ng medroxyprogesterone acetate, norethindrone acetate, or dydrogesterone. Okay, so isa sa mga concerns ng pasyente natin na may PCOS ay fertility concerns, no? Yung hirap po magbuntis. Again, no, this aspect of PCOS will be discussed then, no, in a separate lay forum. So, but we'll just tackle this lang ng konti, no? So, we usually we do ovulation induction using fertility pills, no, for these patients with PCOS who are wanting to get pregnant but having a hard time getting pregnant. And before we start treatment for patients who are obese or overweight, no, we usually encourage them muna to lose weight, no. And baka makarelate po yung iba sa inyo dyan, no? So, for those of you who are trying to get pregnant, you may have been prescribed with clomiphene, letrozole, or hormones such as gonadotropins, or some of you here might have undergone ovarian drilling. And IVF, no? IVF or in vitro fertilization may be indicated in difficult to manage cases or if with other infertility factors that are present. Now, how about metabolic and weight concerns, no? Again, lifestyle management in the form of proper diet and exercise is the key management strategy. Okay? Metabolic syndrome is usually treated by a combination of diet, exercise, and your doctors may have prescribed the drug called metformin. And this is to reduce insulin resistance and improve metabolic parameters. Sa diet, no, there is no single diet that works better than a balanced, healthy diet. And a healthy diet should include the following: eating fresh fruits and vegetables, eating lean meats, cutting out or reducing foods such as sugary drinks and foods high in sugar, salt, and unhealthy fats, and making water na lang your main drink, not naman soft drinks or juice. Now, this is again a very nice info guide that is published by Ask PCOS by the Monash University. So, they have indicated here, ano ba talaga ang proper na exercise, no? Yung exercise that you can do para alam nyo na you will produce results, no? So, let's see here, no? So, for those women who aim to lose weight, no, ang sabi dito, the recommendation will be at least 300 minutes of moderate activity per week. No? Ano po ba ang moderate activity? Ito yun, no? Swimming, walking, or doing sports or engaging in sports. So that's an example of moderate activity. Or pwede din daw po at least 150 minutes per week of vigorous activity. Ano po yung vigorous activity? Examples niyan is running, cycling, or aerobics, or probably Zumba, no? So, for those patients who are hindi naman po on the obese side or overweight, pero they just want to maintain their weight, then the recommendation for exercise would be at least 150 minutes per week of moderate activity, or pwede din po at least 75 minutes per week of vigorous activity. Okay, so this is a very nice summary of the treatment for PCOS. So again, no, you have to keep in mind that the treatment for PCOS is symptom specific, no. Hindi po dekahon ang treatment ng PCOS. Kaya nga po lagi ko sinasabi sa inyo, wag po gaya-gaya ng treatment sa kapitbahay or kaibigan, no. For all you know, baka po nakakasama lalo yung tinitake yung medications na ginaya nyo lang po sa kaibigan o kapitbahay. So you have to be as evaluated comprehensively by your gynecologist or a reproductive endocrinologist to be given the proper treatment for your condition. So, this is the end of my lecture. In summary, I would just like to reiterate that PCOS is the most common endocrine disorder among reproductive age women. It is a complex disorder, as you have already seen, no? With reproductive, metabolic, and psychological features. And lifestyle management has to be a priority for women with PCOS and must be maintained lifelong. And this is the first-line management in all patients with PCOS. So that's it for my lecture. Thank you so much for your kind attention.